Good morning. This is Dr. Timothy Scott Beck here at LifePoint Medical. It is October 20th of 2021, giving you my daily update on what's going on around Raven County. So first of all, I'd like to say that I still really want to encourage people to get that COVID vaccine. It's trumping around the community still here. I'm seeing some of it. It's definitely better than it was a week ago. So I just want to encourage everybody to don't let your guard down, and let's keep fighting this thing. And if you need us or you get the COVID or whatever you need, we're here for you, and we want to try to help you on that. Okay. As far as the numbers go, there's 2,073, and then there's one additional death. And so anyway, just watch out for the COVID-19. So I want to give you a little pearl this morning. Let's talk about ear infections. Otitis Media, which is, Otitis Media means infection in the middle ear. And it can happen in either one of your ears, or it can happen in both. It can be acute or it can be chronic. In other words, it can happen just as a response to over a few days, or you can have it where it's there and it's been there for months. And a lot of times I have to work through differentiating between acute otitis media and chronic otitis media. And they're treated a little bit differently. The chronic is treated a lot more aggressively, and sometimes I have to employ the help of an ENT to get those done. Versus the otitis media, which is usually treated, acute otitis media, which you just give people antibiotics and it gets better. So the thing about the otitis media is actually it's a bacterial infection. We consider it to be a bacterial infection, and certainly it can happen to just be an isolated bacterial infection. However, I will tell you that the most common cause of otitis media is from a virus, and what the virus does is it closes off your eustachian tubes. That tube that runs from your ear to the back of your throat, and when that quits working, that's when bacteria and fluid and nice warm environment in there, and that's when you grow bacteria, and that's when we treat you with antibiotics. And it's usually characterized by ear pain, a lot of times loss of hearing in that particular ear, and then I'll do a physical exam, and I'll look at almost everybody's ears that come in my office, and we'll take a look in there, and a lot of times I can tell that the membrane is gray or white or red, and sometimes it'll be distended, like it looks like it's pooching out and hurts. And if you have changes in your atmospheric pressure, like if you go up the mountain or down the mountain, a lot of times you'll have increased pain because your body can't equalize the pressure in your ear, because that eustachian tube is what that does. And when that quits working, the atmospheric pressure and the pressure within your ears is different, and that causes pain because you have a lot of pain receptors in your ear. Everybody knows that. If you've ever had anything in your ear, anything like that is extremely sensitive. So anyway, we usually treat that with antibiotics, and we have antibiotic regimens that we use that are standard of care. From a prevention standpoint, that's where your Flonas's and your saline rinses come into play. Another common cause of otitis media is allergies. And so we do the allergy testing here basically for that, because we know that if you have allergies and they affect your upper respiratory, that means that you're at risk for developing otitis media. So that's one of the strategies we use. So I have a ton of strategies. That's, like I say, you've got the saline rinses, you've got the Flonase, the nasal sprays, or the corticosteroid nasal sprays. Your antihistamines like your Claritins and your Zyrtex and all that is what we use to prevent or treat otitis media, along with an antibiotic, particularly if we think you've got a bacterial infection. So with otitis media, I always recommend you drink more water, okay, because I think the fluid helps drain the area, and also helps you because if you get really sick and you're not hydrated, you seem to get sicker quicker is what I meant. So anyway, Anyway, that's a little pearl about otitis media or inner ear infections. And interestingly, most of the time the infection is behind the eardrum. So antibiotics delivered by eardrops don't work, but there is another one where you have an infection outside the eardrum, but that's a whole different story. Otherwise, this is Dr. Beck. I've got my Place of Hope meeting this afternoon, and we'll get caught up on what's going on with that. We're still selling the bricks, so if you're interested, we've got brick applications all over the office here, and you can come in and talk to me about. And if you ever wonder about Place of Hope and what it does and how it works, I'll talk to you about it. I talk about it too much probably, but it's really a neat thing, and we want to help our children in this community. All right, this is Dr. Timothy Scott Beck. Thank you for listening to me today. Remember, if you've got any nurses or admin people that think they need a job, we've got job openings. Otherwise, have a great day. Thank you.